Forget all the illegal kids showing up here. Wait till you hear what a lot of them are bringing with them here. Welcome, everybody. I'm Neil Caudle, and a new government report that could be enough to make you sick claims many of these unaccompanied alien children are being treated for communicable diseases like tuberculosis and chickenpox, and that Homeland Security workers are getting sick right along with them. Things are getting so bad that one New Mexico detention facility is on lockdown after a chickenpox outbreak. Now, growing fears these illnesses could spread to kids in this country when schools reopen in September. Family physician Dr. Jennifer Caudle says parents have a reason to be concerned. Doctor, how bad is this?
Well, you know, what's really important here is that families and children are really getting proper medical and health exams and getting treated. And in the case of chickenpox, you're asking how bad it is. A lot of it comes down to how well we're able to identify what conditions we're seeing and then how well we're able to treat them. And in the case of chickenpox, you know, giving the vaccine to prevent these conditions.
All right, so if it's discovered that many have any of these kind of conditions that we didn't know before, and people discover that too late, and so their care workers or those at Homeland Security and others who've been with them are getting these. How big does this get, and how much can this spread before people realize, oh, we got to deal with this?
Right. Well, let's talk about chickenpox. First of all, any of these health conditions need to be dealt with. That's first and foremost. When we talk about chickenpox, for example, chickenpox is a highly infectious condition. Many of us remember chickenpox from when we were kids. It causes a blistery, itchy rash, some fever, some fatigue. It actually can be very, very serious, but most importantly, it can be very, very infectious. And interestingly enough, one of the things that makes it so difficult is that people with chickenpox can actually transmit the virus a couple of days before they even get symptoms themselves. So one of the tricky parts here is actually identifying some of the conditions that we may eventually see, such as the chickenpox, and then of course giving proper treatment and management. But yes, they all need to be dealt with, and they're all quite serious.
You know, doctor, they're about a month away from being enrolled in schools until we go through the full processing of a lot of these kids. We will be enrolling in schools throughout the country, and a lot of those communities and towns, we've been hearing from their mayors and school boards and the like, they're getting nervous and saying that maybe they shouldn't accept those kids and go slow on accepting those kids and enrolling those kids. Is that overreacting?
Well, you know, I'll tell you, I don't think it's overreacting to pay close attention to the medical conditions that the people in our country and coming to our country are dealing with. I will never, as a family physician, I'll never say that's an overreaction, because this is very, very important. And once again, when it comes to chickenpox, we have a vaccine. This is really what we need to be focusing on with things like chickenpox and other preventable conditions. There's a 2-dose vaccine that prevents the chickenpox, and the CDC says that when people receive both doses of the vaccine, it's over 98% effective. So what does that mean? You're probably asking, what's the big picture here? What it means is that we all need to be vigilant, not just about the symptoms we have or our children, but also making sure that we're immunized, that we're getting our proper vaccines, that our kids are getting vaccinated, especially for school time. And that's really, I think, one of the take-home messages here. School is coming around the corner, you're absolutely right, but that's why vaccinations are so, so important.
Doctor, thank you. We appreciate that.
Thank you so much.